Welcome. This is John Kuhn. SSVF provides rapid rehousing. SSVF, by the way, as our program is known, is the Supported Services for Veterans Family Program. It provides rapid rehousing and prevention services to veterans households throughout the country. It targets both homeless and at-risk veterans. And as all of you are listening today, are likely engaged in addressing this public health crisis of homelessness that is now in its fourth decade. It's really hard to describe a crisis as lasting for 4 decades, but of course for those men, women, and children facing the trauma of homelessness, these risks are quite immediate and the consequences can be long-lasting. For a long time we really did not understand how to effectively address this crisis, so instead we managed it. We created a range of support services such as shelters and other interventions that addressed what we believed were the root causes. It was a sincere effort, but one that did not seem to have an appreciable impact on the size of the homeless population. Ultimately, 3 people introduced concepts that have really fundamentally reframed our service delivery system. Sam Severus introduced Housing First, this simple concept that is more effective to first house a homeless person than provide services rather than making housing a reward for service participation. The second, Marge Worley, developed a rapid rehousing concept that demonstrated a homeless crisis can be resolved by a low-cost intervention that focused on addressing the barriers directly related to the housing crisis. And then finally, in 2010, the VA's Secretary Shinseki declared that homelessness among veterans would end in 5 years. And at the time, that goal seemed to be a moonshot, but the groundwork by people like Sam Severus and Marge Worley has made that moonshot possible. So since 2010, substantial resources have poured into programs designed around the principles of Housing First, including the Rapid Rehousing Program known as SSVF. And in fact, in the past year, SSVF has provided about $400 million in funds to community nonprofits to provide services to homeless and at-risk veteran households. And in fact, just over 70% of all the funds that SSVF used were in fact used for rapid rehousing. The impact of these services has been profound, as the next slide will show. So since 2010, there has been a 47% reduction in homelessness among veterans, as demonstrated by this graph, showing yearly declines in the annual point-in-time count. But within this graph, we really can see a second story, a subplot, if you will, that brings us to where we are today. If you look a little closer at the graph, you'll notice that between 2014 and 2015, the results really seem to begin to plateau. And then the impact of those additional resources and the new model of service delivery that began to stall, then all of a sudden it resumed in 2016. In fact, not only does it resume in 2016, but we get the biggest percentage drop since the initiative began. This is all the more surprising since as the numbers of homeless shrink, those left should have the highest barriers to housing placement. Next slide, please. So, what has happened? What has happened is we have discovered the cure for homelessness. Advances in the models we use for services can now be paired with effective techniques for applying these models, such as Housing First and rapid rehousing, so that they are tailored to local conditions and needs. And these techniques are as follows. First, the creation of a coordinated entry and assessment to ensure that households are quickly connected to the right provider who can deliver the needed level of service. Second, the use of a by-name list where homeless persons are identified and followed with housing plans that rapidly rehouse them. Third, planning that matches resources with demand. These community plans are data-informed so stakeholders understand the demand for services, allowing for strategic decision-making and how to triage available resources. And then finally, communication between local stakeholders is vital to ensure that the delivery of services and continuous evaluation of how these services are offered. Next slide, please. So, now that we've discovered the cure for homelessness, we don't want to settle for anything less, right? When you go to your doctor with an illness that can be successfully treated with antibiotics, you don't say, oh, no thanks, I'll have the leeches instead. Of course not. I won't pretend that establishing the practices necessary to deliver the cure is easy. You'll need to leverage your unique role in your community. Remember, resources alone are not enough. Your active participation in community planning efforts and involvement in your local COC are vital for ongoing progress. Communities will still struggle with stubbornly high rates of homelessness due to the lack of affordable housing and meeting the needs of the continuing influx of homeless persons. To meet these barriers and the demands that they entail, carefully examine your community needs, looking at how resources are deployed to maximize their effect. These efforts should be focused on pathways that are informed by data, using techniques, the cure if you will, that have proven successful in other communities. Planning efforts are not static, but they will continuously change as our communities change and as available resources may change. This planning process gives us the capacity to make better decisions and use our resources more wisely. The development of data-driven community plans are vital to our efforts to build capacity and create the system changes necessary for success. With access to an unprecedented level of resources, not only in SSVF, but in a range of homeless initiatives that are now available for veterans, together we have the opportunity to create a model with lasting impact, but only if we use these resources wisely. Build on existing community planning, such as offered by SSVF, Vets at Home, Zero 2016, the Mayor's Challenge, or other initiatives wherever possible, but also lead when necessary. Exercise your role as innovators and leaders so that we may end homelessness and all can get access to the cure. Thank you.